All right, guys, welcome to Drat Veterinary Podcast. I apologize very much for the year and a half hiatus. Um, it's who better to have than one of just my best friends from vet school here. Pretty much one of the biggest inspirations for a lot of the activity, a lot of the things that I've done to be a part of the, not just community of vet school, but the community on the island, and a huge inspiration just do all the crazy stuff, more than just studying, but other things, the extracurriculars on the island. Um, she is or was the SCABMA president of Ross University, one of the biggest influences on campus. I'm pretty sure the things that she's done has already still continued to make an impact on the campus 4 years since she's left the island. With a full heart, I'd love to welcome Dr. Afifa Rahim.
Hi, everyone. Thank you, Dr. Alfred Tam, for having me with you. It's truly an honor, and you were too kind with your introduction. I think you yourself is a testimony of a lot of inspiration to others. And I think you have a lot more charisma than I do. I only tell lame jokes, which I hope to not do on this podcast.
Uh, we're gonna we're gonna start the whole Asian thing where we're just trying to outcompete the other, who's more friendly to the other and
Oh,
talking good.
you
Um,
win. I don't even have to
uh,
compete.
let's go to a restaurant and fight for the bill.
Oh my goodness. Yeah.
All right. So, of course, a lot of things has happened since we've both graduated. We were in the same graduating class, but you did finish about 3 4 months before me.
I did.
Um, and then, of course, COVID hit, a year or two after. And it's probably been a very, of course, a huge emotional roller coaster for all of us. Now, because, we're friends and also friends on social media, we've both been able to kind of follow each other's lives. And I think we've had pretty similar things in the last couple of years, especially during COVID. Um, I believe we've entered our 30s, and we're now adults in the real world doing some crazy real things. We both got married
Yes.
in this time. We both bought a house.
Yes, we did.
Can you share with me kind of how life has been in those aspects?
Ah, Married, adulting. Oh, big topics. So, certainly trying my best to adult. Paying bills is never easy.
So many bills.
Student loans. Marriage has been, I feel, one of the best things that I've had the privilege to have with the partner that I have. Um, so it's a long time coming. My husband and I have known each other since undergrad, and he has shared a lot of my journey towards veterinary medicine. Saw me through vet medicine, saw me start my career in vet medicine, and now he shares my passion through all those 10 years in vet medicine, even though he's not from that vocation, partially because I made it a prerequisite on our very first date.
On the syllabus he had to sign.
Yes, yeah. I laid the ground rules. I said, this is where I'm heading, and I, I can see that you're interested, but animals are my life, and if that is not yours, then you should stop. I made him go for a 1.5 hour walk with a Weimaraner that I was pet sitting, 1.5 hours each way to see
Oh
if it
my
would stick.
gosh.
That was
Okay.
our first date.
That was the
He
test, huh?
stuck.
A 3-hour stroll with a
It was
crazy
it
dog.
was yeah, a 3 hour stroll, that's for sure. I thought that was enough to throw him off, and no, it didn't. And here we are 10 years later.
Well, I mean, I've met Steve, and of course, I know him personally. I mean, he seems, of course, an extremely intelligent, but probably also very patient and understanding
Extreme.
guy.
Very.
Um, of course, my wife now, she's in the same field as me, so we've been able to communicate and share those our days and understand one another. Because he's not in the fields, how does he? Of course, a lot of people who'd be listening are likely in a very similar boat for both of us. It's probably a pretty good mix. But how do you guys handle, such an emotionally charged occupation on, particularly on your end, and how he's able to kind of, um, mix that in with your relationship?
Yeah, our relationship right off the bat had animals in it. He knew that my passion was in rescuing. It
Hmm.
is what keeps me grounded as a person and what brought me to the vocation. So, very early on, when I was a nurse, I saw how veterinarians got jaded over time and how it impacted the quality of medicine that they practice. So, it was very clear to me that my way of keeping myself grounded and not desensitized was to help the homeless pet population as
Hmm.
well as pets in need. Um, and I roped him into that endeavor very early in our relationship. So we started rescuing animals together. He learned. He didn't know how to differentiate Yorkies from Chihuahuas. And that's how I ended up with the Chihuahua I have. But that's a different story. But
Uh-huh.
let's just start there. That was his level of understanding of breed of dogs. But because he rescued all these animals with me and we worked together, uh, he fell in love with the world of vet medicine, although he's not a professional.
Hmm.
And, cut to now, whenever I go around helping the homeless population here in Denver, he's actually my assistant. So, and he's the one, pulling up the rabies vaccines. He's the one writing the
Oh,
records, and he's
wow.
preparing the medications. Yeah. And I can tell a story that really touched my heart very early this year because I'm like I'm with the right person and I'm so lucky. So we had the wildfires up in Superior, Colorado,
Hmm.
at on New Year's actually. And what happened then was I've always felt compelled to help on a grassroots level. So if I reached out to the vet community, if they needed help, they can just give me a call and yada yada yada. But there was Steve actually took the initiative to post on a Facebook page where all the victims of the wildfires and just put the word out there. If there is anything I can do to help, let us know, whether it's donations of clothing or blankets or stuff like that. And there was a family that actually did reach out, and she has two sons and her hubby. That's all she said. And they needed clothes and they needed shoes because all they had was whatever was on them. Because they thought, oh, the firefighters are going to put out the fire and they can come back to their home.
Hmm.
Nope, everything was burned down to the ground.
Hmm.
So we actually met them at the hotel that they were at, and we just provided blankets, jackets, and donated as much of the items that we have that were gently used to them. And lo and behold, guess what was also in that hotel room? Two golden
Uh,
retrievers.
yeah.
And immediately I was like, okay, she said, oh, one of my Goldens is not feeling quite right. And it was a 9-year-old male intact Golden Retriever. And so I did immediately my physical exam there.
Uh-huh.
And he actually had an enlarged left testicle. And I
Oh.
was like, okay, now we have a different story. And where I was going with this is immediately I looked at Steve. He knew what was going to happen. All my medical supplies are at home. So we drove through a snowstorm that just started and got all the medical stuff that I need for that puppy and drove back through the snowstorm to provide at least some level of some medications to alleviate the discomfort and pain for that pup until they are able to get to a facility. So even though I could not alleviate the ailment completely, at least the patient wasn't in discomfort and pain. And
Yeah.
it was one of those moments I knew I had a great partner, but there was one of those moments where I knew I had truly a soulmate, somebody who resonated in my spirit, my purpose, and my greater purpose in life. So we are truly a tag team. Even though he is an engineer, I have been so blessed to have someone who recognizes my vision, my drive, and my purpose, and who choose to partake and be an active player in it as well.
Yeah, I love that. I think it's what's incredible is, obviously his lack of knowledge with the veterinary field. It's really, I mean, probably initially solely driven by his love for you. Yeah, right. And
Oh
it's
my
just
god.
it's I mean, it's incredible, and now it's of course this love for you, this almost obsession, and not in
Mhm.
any creepy way, but has trained him to then develop a passion for others and for animals. So that's, I mean, I gotta commend him. That's amazing, you know.
Yes, he's an amazing guy.
That's a great story too. I think again, you fail to you fail. I'm never surprised by your continued efforts to do things for other people, for other animals. And this is again, I'm glad I'm able to talk to you today because that's just going to further the the it's going to further drive me to continue to do things. I've been a little bit more stagnant the last couple of years with certain
Mhm.
things, but
No,
yeah.
I'm sure you're doing great things. You tend to undermine the efforts that you've been partaking in. So I'm sure there's a lot that you can share as well.
We'll see. We'll see where this podcast takes the world. Huh? Now,
Sounds good.
so now another thing that's very similar for us is we did GP for a couple of years, and then we both entered into emergency medicine.
Yes, we
Um,
did.
I entered into emergency a little bit earlier than you did.
Yes,
To my understanding, you stopped earlier. I think it was either at the end of last year or the beginning of this year, and
yes,
now you've started your transition into emergency medicine.
that's correct.
Okay. Very, very broad question, but how's it going so far?
I love it. I think the first year of general practice, I already felt a little unsettled
Mhm.
because in vet school you go 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 and you're constantly studying
Yeah.
and constantly being challenged, and then when you start work, it almost feels as if the academic portion of it dwindled, and it's more so about the experience of um, talking to clients and communicating and being able to translate the medicine that you know into reality. And so I did that for since 2018. And one thing but I still had that nagging feeling
Hmm.
that I want to see more and do more. And the practice that I was at, I loved my team, I loved my clientele, but there was some level of limitations to the medicine I could provide, even though I had the ability to provide it,
Hmm.
because of the fact that we are a daycare facility. I couldn't hospitalize anything overnight. So that brought about certain levels of limitations
Hmm.
to the medicine that I could provide. And so I actually gave a 6 months notice to my to my current practice, to my
I,
previous
I
practice.
think I gave a nine. I think I also gave a 6 or a 9 month notice because I knew, yeah, with my
Yeah,
GP, I was because Pam was gonna go start her internship. So I was like, yeah,
yes,
so I'm leaving in November. I know it's
yes.
March, but just want
I
to get, yeah.
Yeah, because with COVID, it was already so hard.
Mm,
There were so many practices who are in need of
yeah.
veterinarians, and I didn't want to kind of give them like a 1 2 months heads up and say, "Hey, I'm gonna go." And
Hmm.
even even after I left, I was still kind of helping out a little bit.
I bet. I'm not surprised.
So the Vet Emergency Group Fellowship is truly a well-paid internship that's focused solely on emergency medicine.
Yeah.
And I am very fortunate, to have mentors and also a structured program to ease you into vet medicine, the emergency portion, without throwing you in and kind of sink or swim kind of mentality.
Yeah. Hmm.
Partially because one thing that is unique about it is that we do not have specialists that other specialty hospitals would have. So, like an internal medicine specialist to kind of run to a criticalist or is a board certified surgeon. So, in a way, it does allow us to learn through other emergency vets who have had the experience,
Hmm.
and allow that transition to be a bit smoother. Part of the fellowship does involve learning from internal medicine specialists, criticalists, board certified surgeons, and even an exotic specialist, because we do see that in the ER too. And having access to them via our phone should we need them for consult.
Yeah.
So I think there's two parts to this, which I hope that we will eventually touch on, because part of it involves the structure of vet medicine or medicine in general,
Yes.
where a lot of people who want to pursue specialties are underpaid and overworked. And I do have certain feelings about that. Um, and
Same.
number two, and number two, I remember the podcast you and Pam had. I remember that because you guys had a debate about that portion. So we can
Absolutely.
definitely get into that as
Okay.
well. And then the second portion about it is the culture
Yeah.
of mentorship, is the other. So yeah, the financial and the culture.
I
So I
think
think we have at Veg we have both.
Yeah, I feel like, my take on veg right now is they are absolutely killing it in the market right now. I'll have to say particularly emergency. Now emergency, I think in the last couple of years, you may agree or disagree. Just with COVID, it's just been a complete boom in the veterinary market. GPs are booked up weeks ahead of time, so now general practice medicine is now trickling into emergency.
That's right.
The amount of ear infections, the amount of skin infections, and just things like that, are gonna as things that I've seen that just kind of doubled my caseload during this time.
Absolutely.
And veg being now a huge forerunner in emergency medicine has
Yeah.
taken advantage of it. It's interesting that you're talking about. I love the fact that they have a good structure now. They're currently, everyone I know who works with them or works for them cannot have has nothing bad to say that about them. It's all everyone who's outside of the veg circle almost calls them like a cult because it's like, what is going on here? Why is everyone like wearing all this veg equipment? They have veg cups, veg badges, veg this. They tag veg. They're hospital all the time. Like no one does that. No one really tags. VCA or Blue Pearl or even like Banfield nearly as much as veg is tagged by their staff.
Hmm.
And as an emergency doctor I work in a specialty hospital,
Yeah.
and so um, to see a lot of our doctors, as we're also short staffed, a lot of our staff or our potential hirings are not coming to us; they're going to veg, and I feel like a lot of the reason why is that positive culture, as well as financially. I think that they are they're offering nurses and doctors a very, very generous amount of money. I'll take that away. I won't say generous. I mean a very reasonable amount. And I think that nurses, in particular, are getting
Yes.
paid a very reasonable and healthy amount to allow them that they're worth. So as frustrating as it is, as a hospital 10 miles away, to see staff that we would like to have being over there instead, I can't help but understand why.
I do want to touch on two primary things that
Mhm.
you talking about. Let's talk about why people are not, the level of pride that a lot of what we call ourselves veggies have for their, for, it's so weird, but I don't know. Yeah. Anyway,
Uh-huh.
veggies have for veg. Dr. Sean Callanan, upon my graduation, gifted me a book about women in leadership. And one of the things that really stuck out to me about that book was how vet medicine is late to the game when it comes to technology. And that really stuck with me because till today, outside of veg, I even when I was in my previous job, I did feel some level of hesitance to post anything online,
Mhm.
right? Because it's almost seen as narcissistic.
Yep.
It's almost seen as a little taboo, right?
Yeah.
Because your sense of confidentiality and stuff like that. But the truth of the matter is that is the world that we live in now,
Mhm.
and there is a level of distrust in vet medicine, and people are obtaining their information elsewhere and from bloggers, people who made themselves into influencers who may not have the professional medical knowledge that we do. And I think we need to do, as a profession, a better job of not just communicating our medicine amongst ourselves, but communicating the medicine to the masses.
Mhm.
That's one. So I think one thing about is that they actually highly recommend it. They highly recommend taking pictures with clients, with the pets, and putting it out on social media. And that has not only boosted esteem amongst the staff, but it has also provided free advertisement for the clinic itself.
Mhm.
And number three, for a lot of the younger generation, the ability to look into the world of vet medicine and see what it possibly could entail. And I think, and I hope that us as the younger generation of vet medicine, we are able to utilize technology like you are doing
Mhm.
in a to help facilitate and bridge that trust between the general public as well as the professionals in vet medicine
Mhm.
because it's truly needed. Number two, to
I'm
your
just gonna jump in
point.
really quickly, actually.
Yeah, for sure.
That's actually a big purpose of why I have this podcast. It's,
Perfect.
we're not talking about specific medicine of how to, treat heart failure and it's about we're just being real about who we are, how we feel about things. We're talking about our marriages, we're talking about, the things that we do and our struggles in our profession, which is not specific or isolated to just our careers, but yeah.
Absolutely. And I'm thankful that you thought of that. I mean, you have a great voice, you know that.
I don't know
So
about
it
that.
hitting the airwaves would be great for to wake a lot of people up in the morning. Anyway, so the second thing I was going to mention is why are people moving away from the conventional specialty hospitals into veg if they are going for emergency. And yesterday, I even had a client who no longer chooses to go to his general practice practitioner and would come to veg instead, even though the fees are higher for just GP stuff. And this is it. It is in their motto, helping pets and animals at a time when they need it the most in an open and transparent fashion. So anyone who walks through the doors of veg, they can stay with their pet throughout the whole course of the from start to finish, really,
Mhm.
from intake through diagnostics. If a patient is going through surgery, they can actually watch the surgery. They can even watch the x-rays being done and stay with their pet 24/7 if they choose to do so. And I remember being in general practice and veg coming to our practice and them telling me about it, and
Mhm.
I got nervous. I'm like, how is that gonna work? A client watching me draw blood from their pet. Perhaps you got to stick them a couple of times because your vein is tiny. Um, in an emergent situation where you're doing CPR or I'm doing surgery, and I would say I am pleasantly surprised. I think we do not give our clients enough credit.
Mhm.
And that was where I didn't give my clients enough credit to know when to step back.
Mhm.
And I have had just positive experiences because of the fact that they are able to see everything from almost start to finish, should they choose to do so. Because imagine the way, the analogy I would make is this. During COVID, a lot of fathers couldn't be with their wives when their wives were giving birth,
Mhm.
right? So at such a critical and emotional period, what the last thing you want to do is to be separated from your loved one. And when they are walking through the emergency room, they're already worried, they're overwhelmed, they are stressed out. And being able to stay within the realm of their pet should they decompensate means a lot to their pet parent, to that pet parent. And I think, we when we think about things that make a lot of owners mad, it's like, oh, I've left my pet there for 2 3 hours and I've not heard back.
Yeah.
It's always about that waiting time. But when they see that all of us are rushing and doing our best to
Mhm.
cope with multiple things at one time, and we give them that heads up, hey, it's going to take an hour or two before we get back the x-ray report. You can either choose to take a walk, have lunch, and I'll give you a call when it comes back, or just communicating all of that. And they see us rushing, they see us trying to do our best. They're not imagining what's
Mhm.
happening in that treatment room.
Yeah.
They get to see that their pets are being fractious. They get to see that their pet is actually bit us and needs that sedation to get that blood draw. So it just bridges the trust
I
and
think, yeah,
understanding.
you bring up a good point, and I think, we have that there's something called a client-doctor relationship, right? And
Absolutely.
that's exactly how I mean, this is a thing that I feel like, at least it's something I harp on a lot, is just relationships in general. How do you make a good relationship, whether it's with your significant other or anyone else? It is communication. Um,
And
and
transparency.
and
Hmm.
transparency. That's kind of yeah, and I think, yeah, veg. It is as someone from the outside, is to hear that, it's like it does. Your initial knee jerk reaction is take a step back and be like, oh, that's a little worrisome, because we're traumatized by the outliers of those who are very extreme, and we can potentially see a poor outcome. But I do agree. I feel like most owners would probably appreciate that. Um, the way I practice medicine is, and the way I develop my relationship with clients, is very much in an open, it's not so much this kind of hierarchy where, like, well, I'm the doctor, I'm going to tell you what's going to happen, and then you're just going to listen. I very much, sorry guys, I think ladies about to hear something. I very much communicate with them almost as a partner in this
Yes.
case, and
Yes.
I feel like I get a lot of positive feedback from that because of that, Um, but yeah, I mean, can you tell me about? Well, actually, I guess you were saying, aside from those two things I brought up, you were saying there was actually two other parts you wanted to get into. But before that, can you tell me, what is some constructive criticism you might have with, maybe not veg in particular, but
Mhm.
just emergency medicine as a whole?
Hmm. Um, so I would say I touched on how it benefits the client, and I'm going to briefly touch on how the openness helps the doctor.
Hmm.
And I would say that I think the majority of us are already practicing it. The only difference with the facility is that there's only a couple of rooms,
Hmm.
that is put aside maybe for euthanasias or fractious pets or aggressive pets that needs to be in a room. So that open concept helps all the doctors as well. I going to your point about what constructive criticism can I give to, whether it's veg or emergency medicine
Hmm.
as a whole. I've already pointed out one, which was the need to use existing technologies and doing a better job at bridging that and
Hmm.
constantly being up to date for that so that we can keep up with the younger generation. That's one. Number two, I would say emergency as a whole. I do miss my lunch times. My nurses in my GP, I didn't do a good job then. I'm still doing a terrible job now.
Uh-huh.
It's like barely having time to urinate. Something so simple.
Jeez.
It's like, I need to go pee, but I'm going to hold it in because I'm going to type this record real quick or get that patient out the door.
Hopefully the walls to the bathroom aren't transparent as
Oh, that one
well.
is not. We'll spare everybody that trauma. Number two, even lunches, being
Yeah.
able to, stuff some food in and not just go, 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 go.
Hmm.
Part of it is just a me problem, but part of it, I think it is very prevalent, especially in emergency.
Yeah.
You hear it a lot amongst the doctors that, they just go so fast and
Hmm.
they don't even, the next thing you know, it's 12 hours later. And last but not least, I think we have to do a better job about normalizing mental health.
Hmm.
There is still a, and this is going to be a very bold statement, there is still a lot of people out there, whether professionals or not, and some of them higher up in the hierarchy, whether they are deans or whether they are professors, tenured or not, who do not acknowledge, who knows it exists, but still has that sink or swim personality.
Yes.
And my hope, growing up, I am the type of person that would love to be in control of everything. And I have come to a place where I ask myself, what is within my control
Mhm.
and what is not? The truth of the matter is, I cannot change those who have that certain mindset.
Yeah.
But what I hope to bring to the table is for anyone who happened to be under my mentorship or who happened to cross my path
Mhm.
to help, the entire idea of mentorship and productive mentorship, and positive culture, and a positive culture of learning, and being able to recognize when people are in crisis.
Yeah.
And I
Mhm.
think that's very important. It's something that we did a lot at Ross University, and I'm so proud of our team
Mhm.
for being able to do that, because I think it has had a ripple effect. And I hope that ripple effect continues for years to come.
A lot of this, I think, ties into to mention veg, so I guess we'll give them some free shout outs here today. Um, they're the sponsor of today's episode. Uh, and that's actually another reason as to why, like, oh man, we're not getting anyone coming to our hospital. They're all going to veg. And a lot of that reason is because of that positive mental health that I hear. They're so supportive of, at least this, again, from what I hear from other nurses or doctors, they're so mental health positive to not just the doctors, but the nurses. I've worked at, as an assistant or as a doctor, I've worked at a few hospitals where, maybe as a doctor, we're like, oh, okay, let's really focus on their mental health. But the nurses, technicians, the other staff, the receptionists are completely ignored in that sense. And that's horrible. Because it they're really the foundation and the backbone of how we function as a hospital. If we have a nurse that's negative or who doesn't feel like they're being heard and that they're not feeling valued, the quality of their work decreases. Um, the way they communicate with clients, the way they communicate with their team members, and it gets worse, and it brings an entire damper on the hospital, not just in terms of productivity, but as morale. So I think, yeah, again, what Veg does is from what I believe is even the higher ups, they still focus on that aspect for everyone below, which I mean is really good to hear.
I would say, and I don't want this to be all about veg, but I
Mhm.
also want to mention some things that they are doing right that other places can easily emulate,
Mhm.
which is they really frown upon any sort of gossip, and they have a safe word for it. And so immediately, right when you go into, before you even get into veg, it's already clear cut. That you, if if you're starting to gossip, people are
That's a
gonna
little culty now, huh?
people are gonna say something. And the other thing is just that open concept, right?
Mhm.
It's easy to go into the treatment room and kind of, talk about the client or kind of complain a little bit. But when the clients are all around you, you are expected to be on your professional behavior at all times. And that already negates the ability to kind of be toxic.
Mhm.
And that is something that I really feel strongly about as well. So it's not, that's why I go back to that very point, which is, I think it's almost in all of us, right? We want to go to work feeling happy and not worry about, oh, is somebody, talking about me behind my back?
Mhm.
Is this going to be a positive experience? And today, and I would say, if more companies are able to emulate and this becomes the norm, I think vet medicine, not only for its professionals, but also for its clients, would be a lot better. My
Mhm.
hope and goal is that we as a profession are able to reclaim our sense of worth and also what we bring to the table, rather than allowing others, who provide free medical advice on blogs and on websites to have the upper hand.
Mhm.
Um, we have to charge for our services, right? At the end of the day, but
Some
but
yeah.
but 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 that itself is almost something against us. It's like, oh, you just want our money. But being able to see why we do what we do
Mhm,
in a very transparent fashion provides that added value addedness to what we do, instead of saying, okay, I'm going to charge you $500 for these x-rays. But instead it becomes, you get to see how we do the x-rays, why we need the sedation. This is the x-rays, how it looks like. You're going to
mhm,
wait for an hour and then you get a radiologist report, and this is the outcome. So it provides that depth to what we have done,
mhm.
makes it a lot more worth it.
No, absolutely, absolutely. Now, you mentioned mental health, and of course, this is not the first time I've heard you talk about it. We've discussed this quite a bit during vet school together.
Yeah.
You've shared with me your struggles a little bit during vet school,
Mhm,
for probably different reasons.
mhm,
Now, of course, with the way things have been going on in the world, even the last month, not to talk too much about that, but
mhm.
how has how have things been on your end? Obviously, I would imagine the transition from GP to emergency has been, a learning curve. Um, how have the struggles been with coping with these changes? How has it been for you personally since graduating vet school?
Yeah. So, a little backstory that I think and I hope could resonate with somebody out there listening is when I was in vet school, mental health was greatly talked about. And for me, in my mind, it was a lot about work life balance because I was terrible at it. And
Mhm.
it was something
Yes,
I was trying to improve
yes, you were.
for, for myself. But I wanted to normalize the ailments that can't be seen,
Mhm.
but people still struggle with it. So we had a lot of our professors come forth with the One Thing I Know for Sure lecture series, where they were very transparent and courageous in talking about their struggles. Even remember Dr. Scorpio breaking down in front of an auditorium full of students about her story. And I think that took a lot of courage. And I
Yeah.
hope it inspired some people there to seek the help that they needed and the resources that they needed. So I was very well attuned with the signs of mental health. But lo and behold, I was surprised that in my last year of vet school, I too had depression, and I didn't know it initially because I thought, oh, I am just exhausted and I am sleep deprived and I am studying a lot and having little sleep and also having to manage the nitty gritty things of life like grocery shopping, right?
Yeah.
With the little 4 to 6 hours that I have left outside of school. And so once in a while, I definitely got emotional and I was definitely down. But me being a girl, I just said, oh, maybe is that time of the month and I'm feeling extra down. But what made me realize that something was not quite right was I started experiencing memory loss.
Hmm.
So when I went home, sometimes it can be, if you're lucky, you're home by 7. If you The usual day is typically 9 or 10, and then you'll have to read up on your cases for the following day. So I was reading my cases typically like from 10 to midnight, and I would wake up at 4 a.m. in the morning to reread it so that it reinforces the things that I could remember, and also to do research on what the differentials are. And when clinics started at about 6:30, 7 a.m. in the morning, or even earlier if we had inpatients, I realized I was starting to forget. I couldn't even remember the patient's name and what they were there for.
Mhm.
Very basic things. And I was like, what's going on? I just read this like barely an hour ago, right before I stepped out to go to school. And so I studied harder, slept a little less, and worked harder. And I still could not remember. And I started finding things on my day off difficult to do. Things like brushing my teeth,
Uh-huh.
things like taking a shower, and washing my hair. And an alarming thing for me was walking my dog,
Mm,
because walking my dog is one of the happiest times, even if it's half an hour or 15 minutes.
yeah.
And I found that to be very hard to even let him out potty. So it was my emergency rotation, and I have had a lot of breakdowns along the way. And I thought, oh, maybe I'm just overwhelmed, and I'm feeling tired. I don't feel I'm smart enough. But my biggest clinical sign was there is a parking lot, um, where with a really tall building in front of it where we park.
Uh-huh.
And I remember sitting after one of my emergency rotations at 2 a.m. in the morning. That's when we ended. And I was like, that looks like relief, jumping. So I was like, oh my God, there's something wrong, really wrong. And so I picked up the call. Um, so sorry, I get emotional just thinking about it.
Yeah.
So I called my sister, and I was like, you need to talk to me all the way home because something's not right. And yeah, that was when, you know what's funny? The next day was my off day. And I, Dr. Kellenan, he was a dean at Ross. He really wanted me to meet Dr. Audrey Rupel because she is such a magnificent lady at Purdue. And she is currently leading the aging project right now, that has been that is going to get published in Nature. That's how big she is. And Dr. Callanan said, this was way weeks in advance. She's like, Dr. Rupal, I want you to meet FIFA. Both of you are very similar, and I think both of you would mesh together in what you want to do for vet medicine. And so my appointment with her was like at 11 a.m. in the morning. So after going home, mm, and crying so much, my eyes were still puffy. And so I tried my best. I woke up at 8 and hoping that it would subside. And I walked into the room, and I was like, maybe she won't realize because I'm Asian. It's normal. My eyes can be small. I know I just said a stereotypical comment there, but
Yeah.
literally, I'm just being so honest right
Giving
now.
yourself excuses to like maybe this isn't maybe
Yeah,
no one can
maybe
tell.
that,
Yeah.
yeah, it's like I'm Asian. Maybe she doesn't know me. She doesn't know how I look like, but I probably look like poop. So when I walked through that door, and the moment I sat down, she literally said, "Something's not right. Talk to me." And
Wow.
so it's like when you have a lot of pent up emotion, and somebody puts their hand on your shoulders, and everything comes out.
Yeah.
That was one of those times. And here I was just unraveling so much to this individual, um, a lot of um, accumulation of hardship over the years that you just bottle up. And I think
Absolutely.
that was the realization that, I had so much personal things that were beyond my control that I had to keep under control and under the lid to function at school and to survive at school. And on top of that, unfortunately, as I've mentioned earlier, there are just some professionals out there who are not truly professional.
No.
They might be in academia, but
Yes.
people are people. And for me, I struggle when I truly and still do struggle when I see people being extremely rude, people
Mhm.
being extremely hard on others, and things like that. So it just bottled up is where I'm getting at. Uh,
I understand what you're saying. You know, it's
yeah,
there's we can't help how sensitive we are to our
yeah,
environment. And of course, as an intelligent person, like yourself, you know to not lose that level of professionalism. So at the moment, you can't help it how you take it in, but you're able to control how you react. And the best way is to almost try to bottle it in, almost ignore it, try to brush it off, which we know isn't something that can be long term.
And you know me, I don't brush things off.
Yeah,
I try to take it head on.
yeah,
And but that comes at an emotional toll because in a way you are putting yourself in the line of fire.
yeah,
And and that's fine by me, because if it because for me, injustice anywhere is injustice everywhere. And
mhm,
I think the problem with any toxicity anywhere is because too many people keep quiet. And
yeah,
I have made that decision to not be that person. And but I would say where I was going with that story was she brought me immediately to the associate dean, and Dr. Salisbury. And Dr. Salisbury, like, bless her heart, sweet, sweet lady. And I took a week off school. I was basically hospitalized. I had to take medications. And for a year and a half since that day, I was on medications to function, because my memory was terrible, and my emotions was in wreck, and being able to do basic things became such a chore. And it's crazy because it's the year where I'm supposed to thrive and take my boards and do well and be out there doing what I love, but I couldn't. So there were very this brings about a different to put a positive spin to this is, as much as there are toxicity in the world, there's also a lot of people who were there for me and who didn't need to be. And I think that is one of the things that I've learned out this, that people like Dr. Satoli, people like Dr. Rupel, Dr. Salisbury, all these people just came and held on to me,
yeah,
became my safety net, because my family is not here. So
mhm,
they filled that role. Dr. Rupel even said, FIFA, because I told her I don't want to go on with the treatment because it's too expensive. I can't afford it. And she said, don't worry about it. I'll cover it. I was like, what? No. And I still didn't go forth with that. But I was like, the fact that she's willing to pay thousands, right, for my mental welfare, and I met her for a day,
yeah,
right,
yeah,
till that moment, it's just mind-boggling to me. And so my hope and goal is that if when I am in that position, or if I can be in that position for anybody, whether it's in life or whether it's in the world of vet medicine, if
mhm,
I can provide some level of relief in a time that they need it most,
yeah.
that's my role.
I think, I mean, wow. There's, I feel like there's almost a level of luck in the situation. I mean, you at the lowest point, you happen the next day to meet the right person at the right time, who was able to acknowledge, step out of her own comfort zone to call you out,
Hmm.
and then do the right thing about it. That's wild.
Yeah.
Um, I also appreciate the fact that you spoke up about it, because I feel like even if that right person at the right time came out and said, "Hey, what's going on?" a lot of people in our profession, or just a lot of people in general, would still be like, "No, I'm fine," and just completely still keep it bottled in, and maybe would have gone back to that garage. It's just, yeah. Well, I mean,
I agree. I just saw a video the other day that for medical students, after they pass their boards, in order to get their license, they have to check a line whether they have had a previous history of mental
mm,
illness and whether they are treated for it. And so a lot of them choose to not get diagnosed or treated because they can't get their license otherwise.
yeah,
And and this is the medical world. It should
yeah,
not be the
that's
case. So
horrible.
when I talk about culture, I'm talking about a systemic issue that we have, that we are the medical professionals who choose to put those barriers in place for
Mhm.
ourselves. And I
Yeah.
think, and that's something that I hope that we can change as a profession.
Yeah. To briefly share my story, just because again, reasons as to why this podcast has been on delay and other things. I mean, I was luckier. My clinical year, I was in a facility in a system that I felt was extremely supportive for not just the CSU students, but the incoming Ross students. I also was, Avinash and I,
Yeah.
we were able, had my best friend at vet school come with me. He was my roommate during this year, and we both met an incredible group of CSU students who welcomed us as if we've known them for all 4 years. And of course, you've met them at my wedding. Um, what really hit me at my lowest was COVID. Of course, I moved to Florida about 3 months before the pandemic happens.
Yeah.
Um, now, I think my move to Florida, which I've mentioned in the past, is one of the best decisions I could have made for my life. Not only did I, further strengthen my relationship with Pam, I was able to join a hospital that made me as a doctor exponentially better. Now, with COVID, of course, the surge in caseload, the decrease in staff that we've had, I got completely burnt out. I was able to I started joining MMA stuff, as people who've listened to the previous podcast episodes I was really into, but because of the pandemic that was closed down, so I gained 20 pounds, um, and there was this subconscious drop in confidence, in drive, and all these things. And last March, I woke up one day after a week long of hell and torture from work. I woke up in sweat and tears, and I was just lost myself. um, I ended up going to the urgent care, as soon as it opened, and the doctor was essentially like, you sound really burnt out. And yeah, I was on medication for a couple of weeks, to kind of help settle my nerves. I ended up, speaking. I was very open about this to my job. Them also a larger corporation. They have the resources to give us um, people to talk to. Which I spoke to a counselor. I've worked on trying to work on steps. And one big thing that I've done is, I mean, I'm an emergency hospital where I'm the only doctor on staff, and
Oh, wow.
I've had to set limits where, if it's a scenario where my nurse and myself or our staff is getting completely overwhelmed with cases, I'm no longer going to say, all right, well, I'm going to see all 12 of these in the next hour so I can make sure everything's taken care of. I will have people wait. I'll have to set that barrier, or else I'll come back to the way I was, last year.
Yeah.
Um, and so this podcast episode today is, it's my way of trying to also say, all right, let's get back to this confidence. Let's get back to where you were, and let's go back to, like, your passion of what you like to do. Um, and here we are.
There you go. I think knowing yourself, what keeps you going, what keeps you grounded, what keeps you happy to do the things that you love is so important. I think just as a person and also as the professionals that we are,
Mm.
to keep going, and it's longevity, right?
Yeah.
Yeah.
These final two segments, we're going to get into, the first one, of course, our dedicated listeners the last 2 years will know, oma sarcoma, right? So
Yes.
oma, of course, um, more of something that you're currently liking, and something that you're currently either interested in, or what you like. And of course, sarcoma being a not so good case scenario, something that's kind of currently bothering you, or something that just you're not into. Do you want to start?
Sure. My oma is travel, and
Okay.
I think it's the best way to immerse yourself in a community and not just judge a place or its culture through things that we see through the screen or through the books. My sarcoma
Well,
is
let me go
close.
through my oma first, right?
Okay, there you go.
uh, my oma is actually, it's actually just, I thought of it just today. I was watching replays for basketball. It's
Aw.
been it's been like 2 years. So I'm from California, so I watch a lot of I'm a big Warriors fan.
Oh,
Um,
yes, yes.
this is yesterday was the first game that Klay Thompson, Draymond Green, and Steph Curry, the 3 of them were able to actually legitimately play together in, like, 2.5 years,
You were
and,
glued to the screen.
I mean, I actually missed it because I was working, but I was to be able to see the stats, to see the highlights, it was it's shocking how much just, a game, a sport can bring you so much happiness.
Yes.
Actually, I listened to Draymond Green's podcast, and he was talking about this with, Charles Barkley, one of the Hall of Fame legends who's played, and he mentioned just, like, it's incredible just, how their game touches people's lives, and I that resonated with me when I thought about that. But,
Yeah.
alright, anyways, what's your sarcoma?
I think my sarcoma is something that is very pervasive right now. We live in a world of social media where things are condensed into 15 seconds or 30.
Mhm.
And there's a lot of topics in life where it can't be summarized. It is complex. So, my hope and goal, whether that's politics or environmental issues or anything really in life, medicine, for us to delve a little bit deeper and go beyond just a title
Yeah.
or just a snapshot for a much larger issue. Mhm.
I have to, yeah, I think that's very similar to what my sarcoma is. It is the social media aspect. It's this what it really goes into more closely reality TV.
Yes.
Pam, she likes to play it in the background, and I'll come home or whatever I'm watching it, like Love is Blind. She was currently rewatching The Hills from like 2007, and I'm just like, my feeling of it is like people watch this to escape from their own lives, to not reflect on how they should improve. They just focus on how crappy or how horrible these people in reality TV are. And it's like it's horrible because it makes, again, you don't, it doesn't give you time to reflect on how to improve on yourself. It's just like, well, I'm not that stupid. I'm not that, they're making mistakes. I'm way better than that. And it bothers me.
Yeah.
All right, we have a minute and a half left. Can you
Mhm.
tell me about, your current projects? This is kind of a time to do a self promotion on what you do.
Self promotion.
Yeah.
Well, I would say it's more to rather than promoting what I do, I just would like to tell people, that there is always opportunities to help the community and the people around you, regardless of whatever background that you are in. Mine just happens to be medicine. So I would say to look beyond the comforts of your current surroundings and to extend yourself. It doesn't take much to be a light to somebody else's life and to just be a good person.
That is incredibly well said.
Yeah.
All right. Thank you, Dr. Fifa Rahim. I
Thank
hope
you,
to have
Doctor.
you I hope to have you back here again. All right. It's been an incredible time talking to you. And everyone, thanks so much for listening.